It's really, really positive to see so many people have joined us. So I'm just going to whiz through a few little introductions and housekeeping and then hand over to our main speakers. So we've got a wonderful techie colleague who is going to be moving along our slide to the next one, if that's okay. I'm just going to explain a few things and how today is going to work. So Andy, if you can just move to the next slide, please. Thank you. So everybody today, thank you for waiting in the lobby. Everyone today, we have muted everybody's microphones just so that we can make things a little bit easier. So you are not being recorded and you're not being videoed. However, this webinar is being recorded so that we will be able to upload to our YouTube channel so that if you've missed anything or you've got any colleagues who'd like to access this, we can make that available. You'll hopefully be able to see our presentation at the moment. Just towards the bottom left of your screen, hopefully you'll have two tabs. One says presentation and one says Q&A. So if you've got any questions at any point that you'd like to ask anybody speaking, please do feel free to click onto the Q&A tab and to write a question. We can either reply directly under that question, or we might have a little bit of time at the end where we can respond to some of those questions. If we don't get a chance, we will be able to, we've got people's email addresses, so we'll be able to get in touch and follow up if there's anything burning that people would like answering. Hopefully this will take about an hour, and we may go slightly over. If we do, please do feel free. You can carry on with us. You can leave us if you've got other meetings to get to. We are going to be using, hopefully, if technology works, we are going to be using a poll and some whiteboard activities as well. So that gives people the opportunity to join in, to engage with some of the sessions that we're going to be running as well. So they're a little bit more practical. On that, we're going to apologise. If anything does go wrong, we are really sorry. Please do bear with us. We're all still learning how to use a lot of technology in this new world, so please do bear with us. So if you could move over to the next slide, please, Andy. There we go. We are all now going to introduce ourselves, so I'll hand over to Jessica.
Thank you. Hello, I'm Jessica Duffy. I'm the Learning Facilitator for Time to Shine, which is a programme run by Leeds Older People's Forum. It's a lottery-funded project where we're looking sort of through action research at loneliness and social isolation in older people. Thank you.
Hi, I'm Jackie Moores. I work in the Children and Families Public Health team, particularly concentrating on early years, really. So nice to be part of this webinar.
Fantastic. So my name's Rachel Brighton. I also work in public health. My remit is similar to Jackie's, but the complete opposite, that I work in the older people's team and have a remit around healthy ageing.
Hi everyone, my name is Vanita Sembi. I also work in public health with a role around mental health. So that includes sort of suicide prevention, reducing stigma and promotion of good mental health.
Fantastic, thank you. Andy, if you could move us along, please. Thank you very much. So hopefully everybody has come to the right session. Today we are going to be exploring mental health and looking at some of the impact that COVID-19 has had on our mental health. So looking nationally and also a little bit more locally. We're going to be exploring a little bit more about the difference between loneliness and social isolation. We're going to be doing some interactive work with people to understand how it's affected you and maybe some of your work programmes. We're going to be covering some of the more protective factors around mental health and wellbeing, so using the 5 ways to wellbeing. We're going to touch base on a few examples of kindness and good practice that we've seen across the city, so hopefully some really good examples of things that we can share. And then finally, if we get time, we're looking at a little bit around self-care and how we can all look after ourselves. So just a little reminder, bottom left, you've got the Q&A tab. We'll keep an eye on that. Please do ask questions while the chat is turned off. And I am going to hand over to my first colleague to start the main part of the presentation.
Great, thank you, Rachel. Andy, if we can just go to the next slide, please. Thank you. So to begin with, we thought it'd be helpful for us to define mental health, just so that we're all on the same page, really. So we're going to talk about loneliness a little later on in the session, But a definition of mental health that we usually tend to work from in public health comes from the Mental Health Foundation, and that kind of states that if you're in good mental health, you can make the most of your potential, you can cope with life, you can play a full part in your family, workplace, community, and among friends. So it really is sort of being mentally healthy doesn't just mean that you don't have a mental health problem. It means that you're definitely sort of in good mental health. And some people call this emotional health or well-being, and it is just as important as good physical health. So we all have times when, we'll feel stressed or down, anxious, frightened. And most of the time these feelings pass, but sometimes they develop into a more serious problem, and that can happen to any one of us. So everyone is different when it comes to mental health. You may bounce back from a setback whereas someone else may feel weighted down by it for a long time. Your mental health also doesn't always stay the same. So it can change as circumstances change and as you move through different stages of your life. And I guess the final thing just to mention here is that there is still a stigma attached to mental health problems. And this means that people may feel uncomfortable about them. They might not want to talk about them much. And many people don't even feel comfortable talking about their own feelings. But, we'd really say that it is healthy to know and also to say and communicate how you're feeling. Thanks, Andy. If I could have the next slide. So for our first exercise, we have 2 questions that we'd like you to answer on our very fancy virtual whiteboard tool. So hopefully you should be able to see the whiteboard. Maybe, yeah, there it is. So you should be able to see this, and sort of using the kind of tab at the side of the screen, you can use this to sort of type, or you could draw a picture, or you could, however you want to do that. Answer these 2 questions. So the first is, what contributes to good mental health? So what keeps us well and mentally healthy? And the second, what feels different during COVID-19, and what have you noticed that has changed in your idea of mental health, your experience of it, over the last 5 months? So thinking of that. Oh, we've got so many already. Amazing. Oh, this is great. So we can see already what contributes to good mental health. We've got knowing friends and relatives are okay, self-care, good sleep quality, being employed, yep, absolutely, and good employment as well, having good physical health, or at least being able to manage your health condition, yeah. Being able to have the time out to relax, financial stability, absolutely. Having a balance of friends and family around you, good friends, exercise, fresh air. Yeah, these are all brilliant, thank you. And then just looking at the kind of next column, what feels different? So yeah, I'm seeing a lot of worry, anxiety, worrying about the future, routines that have changed and having to have new routines, feeling things that are out of your control. Yeah, these really, really resonate. Anger, especially about misinformation. Missing that actual people touch, absolutely. I think it has been so difficult to not see friends and family, to not have that kind of human contact as we usually would have. Okay, brilliant. Thank you so much for doing that. That worked really well, actually. Thank goodness. That has been so helpful just to get a kind of snapshot of, what you feel kind of keeps you mentally well, but then also kind of what sort of rocked that maybe a little bit over the last 5 months. Fantastic. Great. So, Andy, if we just be able to move on to the next slide. Thank you. And then move on from that one. Thank you. So when we were putting together this webinar, we really liked this idea, and this I think really relates to actually a lot of the comments that we just had on that whiteboard exercise was very much around summing up the last 5 or so months, and we were talking about this idea that, you know, we're not in the same boat, but we're all absolutely in the same storm. And we were talking about this, and I think it was Jessica who said, you know, whether you're in an ocean liner being looked after or in a dinghy about to go under, you know, your feelings are absolutely real and valid. And, you know, our own situations, experiences, and how we react, that is what is all different. And I think there has been, you know, a sense of, well, some people have it worse. And, you know, we really hear that a lot. But I think it's just to say, yeah, all feelings are valid. And this has really been an unprecedented time for us all. And our mental health will, you know, it'll affect and impact us differently day by day. Thanks, Andy. So I'm not sure if you can see this. It might be a little small on your screen, but hopefully you all have access to the slides afterwards. But this is, I guess, a good overview about the potential impact of COVID-19 on our mental health collectively. So some figures released by the Office of National Statistics in April showed that 4 in 5 people are really worried about the impact coronavirus is having on their lives, with more than half reporting that they've experienced anxiety and issues with mental well-being. And since then, since April, we've seen, again, from that kind of self-reported data that, you know, our feelings, particularly of anxiety, are really fluctuating, so have been fluctuating across this period, which again is completely understandable. So obviously we don't yet fully know the extent of the impact of COVID-19 on our mental health sort of collectively. However, sort of in Leeds Public Health and across the wider health system, as well as, you know, colleagues up and down the country, we're really trying to figure this out and understand it and respond to it. So this kind of diagram that you see on the screen is it's from Hertfordshire Council, and I think gives a really useful overview of this impact across the population and also across the life course. So thinking sort of from parents to be all the way to older age adults. And, you know, a lot of these you have already mentioned on that whiteboard exercise a few slides ago. So this really includes kind of isolation, the stress of parenting and school closures, stress of caring for loved ones, unemployment or worklessness, fear and health anxiety, bereavement, grief, loss, which a lot of us, that will touch a lot of us, and it will continue to do so into the future. So what we also really liked about this kind of diagram was that it also gives an idea of the impact on staff and volunteers as well. So that sort of underpins these key issues to consider, and obviously feels really relevant for today's session. So I think it was just, we just thought it would be helpful to kind of almost start with a bit of this overview, just in terms of understanding the scale of this impact for everyone across the population. And I guess not to understate this really, I think, yeah, I guess if we can keep that in our minds, but I think that is it from me for now. So I'll pass on to the next presenter. Thank you.
Jessica, just in case you're on mute, I think we're...
No, you're right, I'm on
there
mute.
we go.
Thank you, Rachel. It's bound to happen to one of us at any rate. Yes, I was just saying, it's been an interesting few months because the Time to Shine project was all about encouraging older people to get back into society, to reduce their loneliness and social isolation by getting out and meeting more people. So we've reached the point where we've asked everybody to go back inside, which was very strange. But I just wanted to talk to you a little bit about loneliness and social isolation. They are two distinct concepts. They're often used interchangeably, but that's not terribly helpful when you're actually trying to support people and change things. And particularly at the moment, that's not terribly helpful because people may have been physically isolated, but they haven't always been lonely as a result, which is quite interesting. So social isolation is an objective state which can be measured. So that is often the thing that is measured because you can count how many contacts people have had with carers or with friends or how many clubs they go to. But what you can't count is the quality of those relationships. And loneliness is much more subjective. It's a negative feeling that comes from a mismatch between the quality of social relationships that people want and those they have. So they may see a lot of people during the week, but if all of those contacts are just very transient, saying hello to a lady in the local shop, that sort of thing, although that may make them feel slightly connected, it doesn't solve a problem of loneliness. I think we all know that you can be lonely in a crowded room sometimes. Interestingly, during COVID-19, people have been physically isolated, but they haven't always been lonely. Lots of people have stepped up to connect with neighbours, to connect with family. People have been more conscious, so they've thought more about making those connections. Other people, I think, have been with people, but maybe not the people they want to be with, and they may still be feeling lonely. So I think we're aware that for some, perhaps sometimes for some older people who may be living at home with family, they're really missing their peers. So they're not actually on their own, they're being physically cared for. It's hard for them not to see and be able to talk really easily to their friends. But yeah, the reason all of this is really important is because loneliness and social isolation are not good for people's physical or mental health. They're usually triggered in older age by things that make people lonely, like maybe bereavement or divorce, illness, loss of mobility. But obviously there's this extra trigger at the moment, which is asking people not to connect with each other. It's been compounded in some of the older people's organisations as well, where there's been a really sudden transition for older adults who were committed and occupied volunteers. They had a useful role, they were doing something, and then suddenly the next day they were told to stay indoors, that they couldn't do all of the things they normally did. And that was a transition that was kind of equivalent to perhaps losing your paid work, really. It was the thing that kept them connected to society. Could we have the next slide, please? Thanks, Andy. Yeah, these are just some of the things some of the feelings that people can be overcome with in terms of loneliness. And I think we can probably all relate to some of those. And some of these are things that have overwhelmed people at the moment. But one of the positive bits of research that's come out so far is that there are some features of this crisis that mitigate some of these social isolation factors. There's a bit of a feeling that we're all in this together, and that sometimes when people feel like they're not the only ones in that situation, they don't feel quite so bad. How that will sort of go forward, it's not very clear, because we're seeming less and less like we're all in this together, as they start to talk about how to shield different groups within society again. But so far, it's not been quite as bad as we thought it would be. Could we have the next slide now? Brilliant, thank you. Yeah, I think some of you will, I hope, have seen this Time to Change campaign. This is really thinking about addressing some of the stigma around loneliness and asking people, as it says, ask twice. How many times have you said, yeah, I'm fine, when somebody's asked you? And you're not really. Maybe if somebody had asked you again, somebody had thought about the reply you gave the first time, how you looked, they might have asked you again. So I think this is a really important thing to think about at the moment, perhaps especially when you're not seeing somebody when you're asking them. You perhaps need to listen a bit harder. If we could have the next slide, that'd be great. And one of the things that as an organisation we've asked people to do is, as we've been doing our research, is we've been asking people how they felt all the way through, asking them at the beginning, and then after an intervention asking them again. So we've had a bit of practice asking these sensitive questions about whether people feel lonely. People often feel quite upset when they're suddenly brought to think about it, and that makes them feel sad. So, but we've realised that if you ask people that question and you mean it, so if you're going to say, how are you today, you need to be prepared for perhaps 3 things to happen. You might need to actually commit some real time to listening to their answer. If you walk away from somebody at this point where they've started to tell you how they're really feeling, it can be much harder to gain their trust a second time. You might not have loads of time to give just now, but if you can listen for long enough to say, I can hear you really need to talk to me, perhaps we could talk again at some later point. You can judge that one, but you might need to commit to some time if you're going to actually ask this question. It might also cause you or them a bit of British embarrassment. We don't talk about feelings, do we? So maybe you need to reassure them that feeling embarrassed isn't the most important thing. Their feelings are really important, and it's okay, and they can talk to you. And the third thing is you might actually need some tissues. They might cry, you might cry, but that's not necessarily a bad thing. Nothing bad will have happened apart from the fact you might have got a bit soggy. But if they've been prepared to share how they're really feeling, they may feel better, and you may be able to start to signpost them or get them to think about things they could do that would make a positive change in their lives. Thanks. That's it from me. Thank you.
Thanks, Andy, for moving the slide on and for your presentation, Jessica. So we're now going to move on to look at ways of not only potentially exploring what's going on for people, but also, importantly, how to move things forward and help them to feel better about their situation. So when we're talking about our well-being from a mental health perspective, I guess it's important to recognise that this is only really possible if our basic needs are being met. So things, for example, like you've got decent housing, you're okay financially, you've got enough food, and that you feel secure where you live. If any of those things are not present, then actually even thinking about your well-being it can be quite challenging, really. So once those needs have been met, it's been discovered really that having more wealth doesn't necessarily mean that our well-being is better. So I guess the big question is what does? And quite a while ago now, in 2008, an organisation called the New Economics Foundation looked at research that's been carried out into well-being, and they looked at over 400 scientific papers to identify what are the key things that, you know, whether it in different communities, different countries actually show are important for our well-being. And that's when the 5 Ways to Wellbeing was created. And they can provide a really helpful starting point to help us reflect on our own needs and the extent that they're being met, but also identify gaps, and then you can go on to explore how things can be improved. And linking to the situation with COVID, etc., the New Economics Foundation on their website have actually done a piece in terms of how those 5 areas have been affected, just from a person's perspective who works for the New Economics Foundation. So that's quite interesting to have a look at and see what happened from their perspective. So what we're going to do now, very often by experiencing how you use a particular tool or approach, it then puts you not only in a position to think about yourself and make sure you're in the best place, but also to think about, if you're working with people, how you could use this to help support them. So we're going to have a go at looking at the 5 ways to wellbeing in detail, and then doing an exercise. So Andy, if I could have the next slide, please. So these are the 5 ways to wellbeing, and I'm hoping you can see them. So they are: connect, be active, take notice, keep learning, and give. And as I say, these are the 5 areas which really came out of the research that the New Economics Foundation did as being key. So connecting, very much about having those social contacts, but actually good social contacts, so not, as Jessica mentioned there, just a passing contact with somebody, but the quality of them as well. Being active, I guess, speaks for itself, but around going out and trying to be as active as you can be. Taking notice in terms of your surroundings. I guess many of us in the past have been used to just getting from A to B and thinking, how on earth did I get there? We've probably not noticed anything. This is about taking time to notice what's around you, and I guess what brings you a bit of pleasure as well in terms of what's out there. Keeping learning, that's definitely linked to keeping our minds active as well, and that can be anything, we're all different. And then giving, and that's not in terms of giving money, really, it's about giving of yourself in terms of time. And I guess, again, during COVID, we've seen a tremendous number of people come forward wanting to volunteer, to give their time to people who perhaps need support. So in this next part of the presentation, it'd be good just for you to have a couple of minutes just to reflect on those 5 areas and think about, from your own perspective, which of these feel are going well and that you're pleased about, and then also to think about which you feel you're currently neglecting, or you feel there's room for improvement. And once you've had a minute or two just to have a think about those, we're going to have a vote to see, for those on the call today, which ones seem to be going well that you're pleased about, and also which ones we feel we're currently neglecting. So I'll ask Andy to bring up the voting screen, and then when you're ready, just have a vote. These you won't be identified, and you can vote for as many as you like. So it might be all of them. There might be just 1 or 2 that you think's going well. But yeah, just have a think and click on the ones that are relevant to you. So it looks like everybody who wants to vote has voted. I don't know, we've got a few coming in now. So I'll just give it a little while longer to get the responses in. Okay, so Andy, can we show the results, or shall I talk through them?
Everybody should be able to see that now.
Right, great. Okay, thanks, Andy. So we'll see from those of us taking part today, the ones in terms of that we think we're pleased about, that are going well. Being active seems to be top of the list, and giving is next. And there's been a change in the percentages since we've put it up. Oh, right, okay. And it seems like the ones that we're potentially neglecting are the other 3. The taking notice is down there, but also keep learning and connecting. So let's move on to the next vote now, which is in terms of the ones that you feel you are currently neglecting. So again, just vote for, if it's just one of those, fine, but if there's more than one that applies to your situation, then by all means vote on different ones. Okay, I think that seems to be everybody's voted now who wants to. So again, if we can make sure everybody can see the results, and it's actually quite an even split. Actually, seems to be the one in a way that everybody seems happiest at, i.e. they're not neglecting, is the giving part, which is interesting, and then the rest of fairly evenly split in terms of that there. So it's just a way of capturing really what is going on for yourself really at the moment in terms of what you're how you're doing. And the next part of using the 5 ways to wellbeing is to then sort of, once you've identified what you're currently neglecting, then is to sort of pick, if you voted for more than one, is to pick one of them to then look at moving forward on, to think about what will help you to improve it and what will help you to do this. So it might be that you've got an idea of how you can perhaps take more notice, and what will help you to do this. It might be involve other people, but it'll vary according to us individuals. So I think, Andy, the next one now is to show the whiteboard, which really we're going to, as many of you actually said that taking notice was one of the things that you were neglecting. What I'd like you to do now is just to think of either just one thing that will help you to take more notice, and it might be if you're at the moment thinking, oh, I'm actually taking notice, no problem, you could perhaps share what you're doing to help you do that. So that's great. We're getting some ideas there. Yeah, interesting. Yeah, about the slowing down. Part of taking notice is to actually feel like you've got the time and the permission almost to have the time to actually look around there. Yeah. Yeah. So lots of different ideas coming up there, and yeah, noticing the small things. I know personally that this spring, which does seem quite a while ago now, actually, watching how things developed. I'm sure they develop like that every year, but I had the time to notice them this time, and it was really nice to see. So a bit like stopping to smell the roses, a bit like that. So so great. There's some more things coming up there as we go, but lots of, I think hopefully what you'll notice from that is that there's lots of different ideas, and I think that's key if you're going to be using the 5 ways to wellbeing to work with people, and it's really important that we approach everything from their perspective. So how we will all take notice, there's lots of different ideas on there, and the people that we might be supporting will also have ideas. So it's not about us saying, oh, well, to take notice you should do X, Y, and Z. It's about helping people in their circumstances to come up with the solutions that will be possible for them. And it's like with many things, it's small steps to improving things really. So thanks for putting your ideas up there. Really nice to see. Lots of variety and different things. So I think it's time now I hand over to Vanita for the next slide.
Great, thank you, Jackie. So in terms of key places sort of to visit for support or signposting, we decided to keep this really simple. And I think one of maybe a couple of the comments on that very first whiteboard exercise was around the kind of overload of information. And I think we've really seen that there is so much information about there, particularly about mental health, nationally and locally. And I think things are, they're changing quite rapidly as well. So yeah, that really resonated in terms of there being a lot out there, and sometimes that can be quite overwhelming to navigate that. So we thought we'd keep this part really simple, and if there's anything else that you'd like to know about more specifically in terms of specific services, we can maybe catch up about that maybe at the end of the session or after the session. So for the main hub of information about mental health in Leeds, we really do recommend, please do take the time to explore the Mindwell website. So they have a coronavirus mental health hub, which has resources, videos, all the latest information to help people in Leeds take care of their mental health at the moment. There's also a specific section for professionals as well. And so, yeah, even if you are familiar with this resource, I think over the last 5 months, the team have worked really hard to sort of expand the level of information and the resources available on the site to respond particularly to the COVID-19 situation. So please do check back. What is really useful is that they have an updated list of all the mental health services, support groups and helplines currently available. So a really comprehensive sort of directory of what's available, but also how they have sort of adapted their service offer. So of course, a lot of services are now offering support over the phone or by video call. So it's just a good place to check back and see kind of which services are out there, but also how they're running, when they're running, and just to keep updated with that. So would really recommend having a look through that. They also have a tutorial video on YouTube, and again this link is on their Mindwall site. And this can also help you to navigate the site and kind of find information you're looking for and really make the most of what's on there, because I think it is a really useful tool, and there's so much more on there than maybe you might first think of as well. So they've also recently developed some really accessible sort of printable paper resources that you can sort of click a link on the site and it will take you straight through to those PDFs, so you can print those straight off. So if you want to sort of give those out to people you're supporting, or even in obviously a personal capacity as well, so that's also really useful to know about. They have sort of paper printable resources on quite a few different topics. So there's one which is around finding help in a mental health crisis, which is really useful. And there's also some that are around kind of more broad self-help ideas and tips. So how to eat well, sleep well, reducing stress and anxiety. So again, really useful. Thank you, Andy. Can I just have the next slide? And also we can use Mindwell for ourselves as well. And I think for professionals, as professionals supporting others, it's also incredibly important to look after your own mental health. So we might call this sort of self-care. And on the screen here is just one example, really. It's called an MOT checklist, which is really clever. And you can sort of use it whenever you need to. You can use it with someone you're supporting, or that might be sort of professionally or personally. And you can just sort of go through this tool to check through in terms of how you're feeling, and understand sort of what might help you to feel better. And in doing that, you can sort of reflect on some of the 5 ways to well-being. If you've been able to identify, actually sort of connecting with people, I'm not really doing so much, so I can make time to do that, or I'm not sleeping so well, so I'm going to explore some kind of tips and resources to support me with that. And it's just a good way of capturing that. Looking at your pressure levels, looking at your energy reserves and what you need in terms of recharging your batteries. It's just, a simple way of just looking after yourself and checking in with yourself as well. So I hope that's helpful. I think we're on to the next slide now, Andy. Thank you.
And it's back to me. Thank you, Benita. So we just put a couple of slides on towards the end just to talk about sharing good practice and sharing some of the really nice things that we've seen across the city. We're aware that these are the examples that we've seen will be really, really small in comparison with the huge amount of efforts that people have gone to across the city to kind of share and to show kindness and to support and offer and give and connect. So I'm sure lots of people have seen rainbows in windows. This was a big thing that I realised over the last few months when I was going for my little walk around the estate, taking notice and taking notice of some of the rainbows and kind of how some of those things felt. Some of the things I really took notice of and got a little bit emotional about was when the buses drove past and they said thank you to our NHS or our care workers as well. So just to have a look out for some of those kindness sort of opportunities that people have done and shared, and just to kind of remind us that we can all do what may feel like really, really small things, but can actually kind of make a difference to those people who are looking out for some of those things. I've also realised that I've taken a lot of notice of what my neighbours do. I've been very nosy sitting here, as I'm sure many people have, being at home more. So a couple of examples that we wanted to share that came from some of our partners and some of our provider organisations. We've had loads of fantastic examples of kindness and support, particularly from our neighbourhood network schemes. I'm not sure if there's many of or any of our neighbourhood networks on the call today. So lots of our schemes have got lots of big groups of volunteers and have seen a huge influx in the number of volunteers as well registering, and that's in addition to the national efforts for volunteering, but also the citywide efforts for volunteering. I think I've moved my slide on without you, Andy, have I? If you could move the next slide on. Sorry, Andy. Thank you. So lots of phone calls, lots of befriending, lots of volunteering, lots of knocking on doors, waving through windows, all sorts of different offers of support, and people have probably seen a big influx in the number of phone calls that befrienders have been able to offer as well. So loads of great examples there. There's an example that I think Jessica might have added here, which is a particular neighbourhood network scheme potentially delivered flowers for some of their older people to put in their gardens, delivering craft and activity boxes. I know we've had some who where we've had streets and they've delivered sunflower seeds to everybody on the street so that everybody could plant their sunflowers and almost have a sunflower growing competition on the street. So really kind of what may feel like small things and small ideas to some of us can really make a big difference to some of our more vulnerable or isolated communities. The picture on the screen at the moment, people may have seen the Shine magazine, which was produced through Time to Shine. So that was a magazine that was delivered to some of our more isolated communities, and an opportunity to share really nice positive stories, key messages, and to encourage some of our communities to write stories themselves as well. We had something that I think we took from Manchester, which was a creative care kit. So there was an organisation in Manchester who wrote a booklet about all sorts of different creative and active things that we could all do in our own homes that we wouldn't need specialist equipment for. So things to make, things to do differently as well. So we will look at a way of sharing all of these things as well, so that if for any reason we are stuck at home a little bit more, especially towards winter, we've got some examples of some good things we can share with other people as well. I don't know if there's anybody on the call from Richmond Hill Elderly Aid, but we believe they set up street bingo, and I think there's another few neighbourhood networks as well which have used some of their learning to set up street bingo, where there's a bingo caller and people are encouraged to come to the end of their drive or their garden and join in bingo. So real creative ways of putting a smile on people's faces. And then some additional sort of more community care support groups. There's been some really good examples of groups working together as well. So I know, I'm thinking Bramley, there was the Community Care Hub who had the food parcels for local people. They were working with the local running group who were then able to deliver. So the running group were doing some volunteering work, the hub was supporting people, and then people were getting that little bit of connectivity as well there. So really great examples, and like I say, I think we really need to be we really need to shine a light on that as a city, so that we can see some of that kindness and some of those real great opportunities shine through. Just in terms Vanita was talking about Mind Well as a website. Just as a reminder, we also have the Public Health Resource Centre, which I'm sure many people are signed up to, but if not, you can just Google Leeds Public Health Resource Centre, or it's on the Leeds City Council insight pages. And there's a dedicated COVID page on there as well for anybody working in health and wellbeing. Lots and lots of links to different topic areas, different resources, different guidelines, and things that people might find useful. And there's also other webinars and learning opportunities there as well. So please do, in your own time, have a quick look on the resource centre. And please do keep in touch with the resource centre if there's any topic areas or resources or anything that you think we could do more to support people with as well. Oh, I need to not move on. I need to ask Andy to move on to the next slide, if that's okay. Thank you. So I think I'm handing back over to Jackie.
Are indeed, yes. And I guess just to add on to the things that are available from the younger person's perspective, there's also Young Minds and MindMate are resources which are helpful for sort of younger people who are have issues with mental health as well. So just to mention that, and also a quick reminder about the Q&As if there's anybody who's got any things to add to that before we finish off. So that's really the end of the content of the webinar now, but it would be really helpful from our perspective really to get your thoughts in terms of what you've got from today's session, and also one thing you'll do differently. So if I can ask Andy to put on the whiteboard. So you're used to using this, we know you can, so that's good. So if obviously there's one thing you've learned from today's session and one thing you'll do differently, so if you can just type away for a few minutes, we'll see what people are putting up there. Yeah, it's interesting. Obviously, many of you are putting the 5 steps to well-being, and it just shows, I suppose, that I mean, the research was done 12 years ago, and it's I suppose it's like many things, they come and go. People might have heard about them ages ago, but not recently. So it's good to hear that. And yeah, the slide is quite powerful, isn't it? About the we're all in the same storm but in different boats. Yeah. So conjures it up quite nicely. Yeah. And then obviously in terms of doing things differently, there's a few of you have put actually using some of the resources that we introduced. So the MOT checklist, both for ourselves and for people we work with. And I think in Vanita's presentation, there's definitely acknowledgement that for many people working with the community of Leeds, you know, it's caused quite a strain for themselves as well. So it's really important that not only are we looking at the impact of COVID on communities, but ourselves as well, and how we can therefore be in the best place to support people, and that's by looking after ourselves as well. So it's good to see there. That's great. So thanks for your contributions there. It's really helpful to see what you've thought about the content. Okay, I think people finished writing. I can't see any new ones coming up. So if we can move to the final slide then, Andy, please. Which I believe is basically oh, here it comes. Next slide. Yeah, there's some links. Yes. So this is just a summary of the links that we've talked about. So this might not be a slide, actually, they might be underneath this, but it's basically to thank you for attending today's webinar. I think Rachel and I were doing this bit as a double act, so if there's anything you want to add, Rachel, feel free.
Thank you. Just to say, we've opened the chat on the left-hand side of the screen. So any questions we've been trying to answer, a few of us have gone on and answered as we go along. I think there's a few techie issues, but also a few people have asked questions where they can get hold of things. So hopefully we've answered those. But if anybody does have any additional comments that they'd like to leave on the left-hand side, if anybody's got any links to anything they'd like to share, please do use this time now. Yeah, we've popped the links on there. We will send the presentation out to everybody who registered for this, and any associated links that we've made reference to, and we did it in an hour, so that feels really, really positive. But yeah, do shout out now on the left hand side in the chat if you've got anything you'd like to ask anybody who's spoken today, and then I guess on behalf of the presenters, thank you for joining us. Please do make use of the resources. Please do have a look on the Resource Centre website, and do check out Mindwell and MindMate, both for yourself, your colleagues, your friends, your family, as well as your service users, patients, and what else do we call people who use services? Patients and our residents and communities in Leeds. So unless anybody else has anything to say, I think we will say thank you very much, and we hope you make use of this, and we hope you enjoy the rest of the summer time out programme.